Prided ourselves with our therapy on developing the highest quality evidence, and previously had published a very high-end double-blinded placebo-controlled study published in Diabetes Care showing very strong healing efficacy, but also very durable healing.
Welcome back inside our proactive newsroom, and joining me now is Mike Griffiths. He's the CEO of AOTI. And Mike, it's great to see you again. How are you?
Doing well, Steve. How are you?
I'm doing well. Excited to have you along because I know that you've got some pretty interesting news coming out, all related around this topical wound oxygen therapy that we've talked about in the past. But maybe for those not familiar, just remind everyone what that is.
Yeah, it's a unique multimodality therapy that utilizes oxygen and non-contact cyclical compression that patients apply themselves at home, and it's used to help heal non-healing or what they call chronic wounds.
Okay. And so as I mentioned, you've got some news out, and that is that you've got some really interesting data that's been published in the Journal of Vascular Surgery and Vascular Insights. And this is it was a large study that covered a lot of different areas. So I'll let you take it from there. It was a pretty interesting one.
Yeah, no, we're pretty excited. So we've sort of prided ourselves with our therapy on developing the highest quality evidence, and previously had published a very high-end double-blinded placebo-controlled study published in Diabetes Care showing very strong healing efficacy, but also very durable healing. So not just over 12 weeks healing, but maintained over 12 months. And then we had some follow-on studies from that looked then in the real world, did that really impact long-term outcomes like hospitalizations and amputations on these patients? And that study that was published back in 2021 shows significant reductions. And what this is now a much larger retrospective study looking at over 3,200 patients that showed the same high healing efficacy, but also, very importantly, the very low occurrence and the very durable healing that resulted in significant reductions in hospitalizations and amputations. Now in a much larger data set, looking at patients with very comorbid conditions that you see in the real world.
Yeah, it covered a lot of different wounds, but the other really interesting thing about this was the fact that over 64% of those achieve complete wound healing, right? That's quite significant.
Yeah, that's very significant. And these are wounds that had not just had standard care, in many cases that had failed to heal with other advanced modalities.
Yeah. Tell me a little bit about how you take data from this and study from this and sort of move to the next stage here. Because I know there's a lot of work that's been done, but there's still more work to come.
Absolutely. Yeah. As you know, I mean, what we're doing is just building on our evidence base, supporting the durable, that's unique about our therapy, these sustained healing outcomes across different wound types. So predominantly here is diabetic foot ulcers, but a significant number of venous leg ulcers and arterial wounds as well were in this study. And where that's critical is obviously getting regulatory approvals and having evidence and adoption is one thing, but it's very important that we persuade payers to want to cover the therapy. So where this is very important, it adds significant weight to the evidence base utilized by the various payers around the world that are making decisions on reimbursement and coverage.
Yeah. And just on that, the last question I want to ask you is about it really looked at also at the patients that ended up needing hospitalization, and within this, that's where obviously people would looking for insurance and things like that becomes a lot more expensive. So this particular one, you were well below the benchmarks, right? Maybe you can talk about that part of it because I think that's significant here.
Yeah, and I think that's the critical thing. Obviously, in this day and age, we need clinically beneficial therapeutics that move the needle on quality of life and length of life. But also, we need to look at reducing cost and burden on the healthcare system. And by healing wounds more durably and keeping them healed and lowering the recidivism, we showed enormous reductions in both hospitalizations and then resultant amputations that these patients normally suffer from. So we're talking low single-digit hospitalization and amputation rates over nearly 14 months, where we're expecting usually 50 or 40% hospitalization and amputation rates in that patient population. So the benefit is not only wonderful for the patients and the clinicians involved, but obviously significant health cost savings to the healthcare system, because the most expensive thing you can do is hospitalize a patient and ultimately remove their limbs.
Yeah, important information for sure. Mike, thanks so much for sharing with us. I really appreciate your time.
Thank you, Steve. Good speaking to you.
All right. Mike Griffiths, the CEO of AOTI Inc.